Hey, how you've been? It's time for a disclaimer before we start our program tonight, and by the way, Happy New Year. Before we start tonight's program, this is a reminder that this episode will address mental health and depression, which may be sensitive to some of our viewers. Viewer discretion is advised. We remind you to please consult your doctor, your mental health professional, your outreach group, your sponsor, or specialist before adopting any change to your dietary, physical, and/or mental health regime. If you are looking for options to go down with respect to mental health, contact SAMHSA, the Substance Abuse and Mental Health Services Administration, at 1-800-662-4357. The service is open 24/7, 365 days a year, and is a confidential, free information service for individuals and family members. Also, if you're feeling suicidal crisis or emotional distress and need to be put in touch with a crisis center, please contact the Suicide Prevention Lifeline at 1-800-273-TALK. That's 1-800-273-8255. Or go to suicidepreventionlifeline.org. You can also text the word HOME to 741-741. Again, you text the word HOME to 741-741. Those resources are available 24 hours a day, 7 days a week, 365 days a year as well. And on that, let's begin. Tonight, we start a 3-part series on depression. And we also talk about something that's happened to me in the last 3 weeks. Something that I never thought would come back to my attention since it last happened 10 years ago. But we'll talk about that. We'll talk about depression. And we'll talk about how those two things intertwine with each other. This is The Venture Forward. Good evening, or good morning, or good afternoon, wherever you may be, and welcome to The Venture Forward. I am John Venturini, and I'm a recovering addict of overeating, alcohol, and compulsive gambling. And over the last 4 months, we've talked about those 3 chief addictions, and moreover, what that has done to my life over time. Tonight, and into this season, this is season 2, we're talking about what else has been holding me back. Moreover, not necessarily the obvious sort of physical things that we go through, not only the sort of addictions that we go through, but moreover, what happens when you can't feel your face? What happens when memory doesn't come as easy as it does? What happens when your handwriting isn't the same as it used to be? We're going to talk about all of that tonight. And we're going to start a 3-part series on depression. On Thursday, we're going to have a therapist join us about what are the sort of features, what are the sort of things she looks for in questionnaires as far as what has triggered a depressed individual. And then next week, we're also going to talk about what depression means to those of us who have basically battled addiction, that have battled various portions of this mental and physical health journey that we're on. But before we begin and we talk about what has happened to me in the last 3 weeks, let's say hi to who's on Facebook and YouTube right now. Jax, how are you? Glad to see you this evening. Hope you're doing well. Merck, Mr. Stalinsky, hope you're doing well as well. Hope all is well over by you. LT, good to see you. Haven't seen this face since last year. Well, haven't seen that face since last year either. Hope you're doing okay. Gilly, how are you doing, man? Hope you're doing well. So before I go into slideware, slideware. A PowerPoint slide or a Prezi. Because I have one. And we're going to talk about things. Let me talk about what happened to me 9.5 years ago. I was working a very hard job. A job that had me working 22 hours a day, pretty much. And you say, how can you work 22 hours a day? Don't you sleep? There were some days I wasn't. I became very fascinated with my BlackBerry. So much to the point where that BlackBerry followed me to every which room, every which sort of work meeting, restaurants, weekends, weekdays, holidays, you name it. I was on it. Business owning multiple projects. It was a labor of love, but it was also a labor that made me realize that there might be things wrong with me. We fast forward to 2011, January of 2011 specifically, and I noticed that my hearing in my right ear started going a bit clogged. Now, I've always had bad hearing. That's anyone who's known me for years knows that I have bad hearing. Just ridiculous amounts of bad hearing. And yet, this was worse than it ever was. I did different things, the whole candle and trying to remove the earwax that way, and a whole slew of many different things. It ended up becoming like an ENT problem because, I don't know why I couldn't hear. And moreover, the thing that started scaring me is that my eyesight started to go. I had something called optic neuritis, meaning that there are times where my eyeball or my whole eye wouldn't move to wherever the topic was or wherever the subject was or the sort of thing that I was looking at. So after several visits to the ER and ENTs, the question became, well, what do we need to do about this? Obviously, it needs to be something that's neurological. So was working with a neurologist up in Connecticut and had a scheduled meeting with the neurologist to go through a spinal tap and other different things. And the night before, I just got so deathly sick because, by the way, that was another thing. I had nausea for no reason. Could have been the vertigo, what have you. I went to the hospital the night before, and lo and behold, the next day, I went through a series of MRIs, probably the second or third set of MRIs that I'd gone through. Previously ENT sort of things, but now they're looking at my brain. And I go through an MRI with contrast, without contrast. At a day later, they told me, hey, you have something called demyelination. Well, what's that? What's demyelination? Well, there are dark spots on your brain. There are areas where the sort of myelin, so basically the nerve sheath that's up in your brain, is starting to wither away. And it's to the point where it's the onset of other things. It's the onset of many different disorders, but namely, the one that's chiefly tied to demyelination is multiple sclerosis. Now, one event, very hard for a doctor to say, hey, we're going to diagnose you with multiple sclerosis. even though it was a very severe event. It affected my vision, affected my hearing. I was wobbly at times. There was a period of time for like 3 or 4 weeks where I couldn't drive because my eyesight was all off. But that said, because it was such a bad mark to have on your medical record, I said, okay, it's demyelination. For any sort of questionnaire that comes my way, I have demyelination. Fine. Fast forward about a year and a half later, and I'm in Baltimore, and I started to see those sort of symptoms coming back. Stress related. Just moved from Connecticut down to Maryland. So I went to Johns Hopkins. It was probably like the 8th or 9th week I was in Baltimore, because I started to have some of those nuances come back. Explained the situation to the doctor over there. Very, very nice doctor. Incredible doctor. And explained that I don't necessarily want to get that diagnosis now, but I'll keep on top of it. They put me on... So the first time it happened, they put me on Solumedrol, which is this drip. It's a 2 or 3 hour drip, 1 gram over 5 days. This time around, they put me on pill form Solumedrol, another steroid. I think they gave me 70 pills to take over 5 days. No joke. Well, after doing that, I never felt anything again as far as those symptoms. It seemed as if maybe the whole idea that it was a one-time event or some sort of virus or some sort of bacterial infection or fungal infection, that was good. And it was going well for a while. There were a lot of symptoms underneath that I wasn't just owning up to. My handwriting started getting worse. My memory started to become not as good as it used to be. But I kind of ignored it because, all in all, I felt fine. Let's go to November. Now, this is after going through the weight loss journey. I'm down 278 pounds. After being sober for heading to the 2-year mark in May, and also battling compulsive gambling, which has been 9 months and a few days now, I noticed that symptoms started coming back. But I didn't want to own up to that. It started with the hearing again. And as if I forgot what happened 10 years ago, I got something to go clear my hearing, and it didn't help. It came back. The vision started to wander again. Like I got grittiness in my eyes. And then moreover, I'm fighting series of times where I'm up and I'm down and I'm up and I'm down as far as my emotion. The thing is, something was going on. I noticed, I let my PCP know. Wanted to pick her brain on it. Not that she's a neurologist, but she's a great doctor. Really thankful for her. And it went down that same road again. It went back down to a road that maybe, just maybe, it's multiple sclerosis. So, demyelination is one thing to say I have. I have demyelination. As evident from the MRIs I took yesterday, I have demyelination. And the question is, comparing the demyelination now versus 9-10 years ago, what does the demyelination look like? And we're going to be working through that the next couple of days. I've been working with a couple of folks over at the Multiple Sclerosis Center over at Penn Medicine. We'll see what that does. We'll see how that goes. But fact of the matter is, and this is something I said to a few people that I told what's going on. I didn't tell many. I'm going on the live stream to talk about it publicly now, but I'm fortunate that this happened now instead of 2 years ago. If this happened when I was 480 pounds and when I was drinking left, right, and sideways, this wouldn't have been good. This would have been a disaster. An honest to God disaster. But I'm fortunate that's happening now. And the thing is, I'm very fortunate that I'm working with one of the better multiple sclerosis neurological centers in the country. And whatever it is, it is. The reason why we didn't premiere last week is because I was going through this. But I didn't know how to put words around it. Some of you know. Some of you I've talked to. But this is what's been going on. And over the holiday, it just kept on getting worse and worse and worse. There isn't any sort of, well, this is caused by this sort of virus. You could talk about other neurological disorders like Epstein-Barr and other viruses and other bacteria, but there isn't a distinct cause that causes demyelination, that causes multiple sclerosis. And if you look at the term multiple sclerosis, it just stands for multiple scars. That's all it is. It's your central nervous system under attack by one thing or another thing or another thing. So when someone has MS, it's a very individualistic disorder because it can be in many different forms to many different people. It's certainly taking a distinct form with me. This time around, as some of you might know, my upper jaw, my upper teeth are numb. I wouldn't say numb, but desensitized, muted, as well as a portion of my tongue. My right-hand side, from time to time, can be a bit muted. I wouldn't say numb because, again, if someone poked me in the side, I'd feel that. But there is a loss of sensation to a certain degree. So it's been very aggravating, sad, depressing. Funny, we're talking about that tonight, right? Going through all this and realizing that I gotta do something about it. And why not now? Why not now? If I could take down 280 pounds off of me, if I could stop drinking, if I could stop compulsively gamble, there's no reason why this couldn't get addressed now. And if you take a look at the medication sort of landscape these days versus what the medication landscape was 10 years ago, it's a different playing field. Is there a cure? No. But there are a lot more therapeutics and a lot more disease-modifying treatments out there now that help people who have MS. People who have MS live a lot longer. And again, very individualized. Your results may vary. But 10 years ago, it was a very scary thing to, basically look down the barrel of. And now, it doesn't feel as threatening, even though now, to be honest, and keeping it 100 with some of my best friends in here, I'm a little annoyed that I didn't take care of this 9.5 years ago. Thinking that it was a one-time event. Should have went down that road, but then again, medication wasn't the same. A lot of people joined us while I was going through that. Let me say hi to some people, and then we'll start talking about how all of this fits in. Jax, I'm sorry you're in a funk. I hope you're doing okay. And needless to say, I'm here if you ever need to talk, for sure. Sarah, good to see you as well. Marilyn, good afternoon to you. Hope you're having a great Tuesday afternoon. Sammy, hope you're doing well. Gilly with the calculation there. 869,600 calories lost. Heading towards the million. Gilly, I knew I could rely on you on that calculation, and I appreciate you for that. Alicia, how you doing over in Utah? Hope you're doing well. That's a great question. Ren, the thing is this. What could I have done different? I could have gone on one of those crab drugs where you talk about Copaxone, Rebif, and others. I could have done that, but I wasn't so sure, right? Like, there was part of me that was thinking, you know what? It's not that. It's not that. But you know what? I think it is. And there's going to be a neurologist on Thursday morning that's going to tell me, hey, John, it is. So that's where we are. Now, that said, and not to make things more complicated, but for as long as you've known me, I like to complicate things. It's truth. I do have cysts in my nasal cavity that have gotten bigger. That's what the MRI also proved from yesterday. So, in almost the same light of me going on any sort of medication, we're going to have to talk about how to remove those cysts. And not only just remove them, it's almost like scraping the sinus because that's how big they got. Does that have anything to do with what's going on with the myelination? Maybe. Maybe. I'm not a neurologist. Fortunately, I'm talking to neurologists. Fortunately, they have an idea or two about a thing or two. But there is that too. And you may wonder to yourself, boy, he sounds like he's congested all the time. Well, there's a lot of stuff going on up here. Things that could have been removed, Brian, 9.5 years ago. 9.5 years ago. For sure. Alicia asks, who does that surgery? ENT. Yeah, an ear, nose, and throat specialist that either, I would say because of how embedded it is right now, probably it's an inpatient procedure and not outpatient. Although there are plenty of ENTs that will do this as an outpatient sort of deal too. I know that there's a lot of gauze that's stuck up there for the next 3 or 4 days because you're bleeding left, right, and sideways. So that'll be fun. But yeah, it's an ENT sort of surgery, which I'm sure the neurologist will have a thing or two to say about that and work in conjunction with an ENT that is endorsed by Penn Medicine. So, yeah. When we was going to start this season last week, the topic was depression. And the reason why that topic is fresh in my mind is I know many people that went through depression over the holidays. I would have to trail it back all the way to the beginning of November. And then if you throw the other things in the way of, I don't know, this, I'm not going to say it because I don't want to get demonetized, but that thing, and also the social and civil unrest that's going on, plus the events that took place on Wednesday. Yeah. There's a lot of that going on right now. Now, throw in the other topics of, this is a guy who just ended a long relationship, marriage, who has gone through many things he's fighting through, and now you can understand why I may be in that boat. So, needless to say, depression, first in my mind, was the topic we would do this year. Did I wanted to start on the 12th? No, I wanted to start on the 5th, but other things were going on. Alicia says, you work with amazing neurologists, so shoot me any questions and we can answer. Alicia, I'm going to go one better than that. Once we figure out what's going on my appointment on Thursday, I actually want to do an episode on that because I think it's something that we know that the work that the MS Society does, which is amazing work, without question. I think I want to try to address that straight on once we have a better understanding of what this is. So, Alicia, I will be in touch with you for that, for sure. So let's go through some slides. Let's talk about this. And granted, I like to think I've become a bit studious about this, but I'm no expert. Far from it. And they say the more that you spend on services like WebMD and whatnot until 4 in the morning, is not helping things either. But that said, let's talk about this, and let's also try to make sense of this, at least from my perspective. Of course, if I could actually change it, that'd be even better. There we go. That's better. I'm gonna get rid of the ribbon on top, right? So that hasn't changed. There we go. Everybody have a good holiday, by the way. Definitely was a different feeling holiday than all the holidays we've ever gone through. So certainly, we could talk about that too. As far as the venture forward's concerned, we know the story. We know the story. I'm down 278 pounds. I got 22 pounds to go. Moment of honesty. I might have did a little holiday eating, but I'm back to where I was before the holiday. So there's that. 696 days of tracking food, 583 days sober, and 275 days not gambling, which is something that I proudly change on that whiteboard every day. Every day that I stand tracking food, every day I stand sober, every day I'm not gambling is a day that I'm winning, for sure. What's the physical sort of return on it? Well, we know what I used to look like. We know what I looked like 24 months ago, and we know what I look like now. That's physical. We could see that. That's the benefit of the physical transformation that's gone on in the last 2 years. But now the question's going to be, what is exactly the step forward now, especially when you go through the events you went through over the holiday? When you're reminded that, hey, John, you're not done yet. And boy, am I not done yet. So what's demyelination? We talk about the words demyelination and demyelinating the seas and whatnot. It's basically where it comes to a precipice up in the brain, the nerve endings in the brain, the nerves that protect the brain. So what does that mean? The conduction of signals are being affected by whatever is going on there, whether it is a cyst or some sort of disorder or whatnot. You know, basically it's, some people say it's due to being deficient in B12. The B12 levels, the last time I got them checked, aren't bad, but it definitely becomes something where you're misspelling words on slides. But B12, the lack of B12 is definitely something that's tied to your neurological system, tied to your health in your brain and down your spinal cord and whatnot. And the words that are basically in that very text is exactly what everybody gravitates to when they think of demyelination. Multiple sclerosis, multiple scars of the nervous system. And that's what it is. And more they're finding that it's something that is the immune system that has some sort of responsibility as far as its degradation. Maybe it's cannibalistic effect of, here is the nervous system when it's working properly, and this is what happens under an MS sort of disorder. And as far as the lesions that popped up in that MRI yesterday, there were a couple more. As the MRIs from earlier in the 2010s will show, that definitely is the case. I'm going to go back to my screen real quick because there are a couple comments that came in. Sarah says, WebMD is not only beneficial, but it's impacting your rest and sleep, so it's even worse. Sarah, you're spot on. You're on the money. That's why this time around, I'm not so big on the WebMD right now. I need sleep. I can't sleep 3-4 hours anymore. I need at least 6, 7, 8 hours at night. You know, it's the sort of thing that when I moved here, one of the thoughts were, you know, what's sleep? But as time moved on, I definitely need sleep. It's so much so that, you kind of basically make the investment in getting a good night's sleep. And we could talk about that on another episode for sure. But sleep is very important, especially when you're trying to fight something like this. Sarah also says rest and sleep impact depression as well as physical health. Yes, absolutely. Um, I think when it comes to any sort of battery that you're using to gauge how bad your depression is, there is definitely a sleep element to that questionnaire. So tracking that is just as important as, I don't know, tracking your caloric intake, right? So, yes, absolutely, Sarah. Gilly says, how about a bunch of steroids and squats and deadlifts? Pull up burpees. That reset your immune system? Alt Control Delete? To a certain degree. Not completely. But yes, physical activity is one of the things that no matter what sort of neurological disorder you're going through, that's the first thing that gets recommended is up your physical activity. Up it. It means strength training. It means more cardio. It means all of that. So yeah, Gilly, you're absolutely right. And I guess that's sort of the downside of what happened this past year in gyms being closed or whatnot. Strength training hasn't been first and foremost. It is now. There is more work that I'm doing around here, and quite frankly, I'm working with people who are big believers in that. How I can do that sort of strength training without getting the big sort of weights to do that. So it's on my radar for sure. Sarah says, I assume you've told them, but do your doctors know about what you've been doing the last few years? Yeah. Yeah, my PCP definitely knows about the story. She's seen me go through those sort of chapters. I've started seeing my PCP back in October of 19, maybe September of 19. So she's seen me drop another 100 some odd pounds off of that original set that I lost. The 278 is a funny story because the first, I would say, 150 to 200 of the 278 came off quickly, came off within that year point. It's within this last year that it's not so quick anymore. But that said, a lot healthier now than I have been. I'm very fortunate for that. If that wasn't the case, I don't even know if there would be a venture forward, to be honest with you. I don't know if there would be a me. It's just keeping it 100. So I'm thankful for that, for sure. Alicia says, sleep hygiene is important. It certainly is. Without question. It certainly is. Let's see. So, we talked about demyelination. We talked about exactly what I'm going through. Let's talk about what depression is for a second. And here's the thing. We're going to talk about depression a lot more at length on the next episode, and probably on the episode next Tuesday. But it's worth talking about what I'm going through and how it basically ties into this, because some of you know how depressed I've become. And we'll talk about that for a second. It's basically the sort of thing where can be done formulatively. It could be done from a biochemical sort of condition. It can be tied from many different things. Many will tell you that depression runs from heredity, which we've talked about on this show before. And if you couple that in with everything else I've gone through, well, yeah, of course there's a bit of depression here. Have I ever been formally diagnosed with depression or any sort of advanced stage of depression? No, thank God. But I would reckon that because of what's happened in the last 3 weeks, 5 weeks with what's going on with this exacerbation and flare-up, I wouldn't be surprised that if I went down that battery now, that I would probably score a little higher as far as depression. So the thing is this. It's treatable. It's a question of how you treat it. You could treat it medicinally, you could treat it through supplements, you could treat it through other courses. One thing that I've been always told, and the one thing that I kind of stress on this program, is the importance of support, the importance of your therapist, the importance of services like SAMHSA, right? Being able to talk to these things and working with therapists that will try to gauge exactly how bad the depression is. And moreover, anxiety, another thing that runs in my family, runs with me. Having someone in tune with that is the most important thing you can do. Now, listed are about 7 different things, but there are a whole slew of different symptoms that you would go through in any sort of depression exam, any sort of depression battery. It's any sort of depressed mood, loss of interest, loss of pleasure in activities you once enjoyed, changes in appetite. So weight loss or gain unrelated to dieting, that's a key. Unrelated to dieting. There's been a lot of weight loss here related to dieting, but it's that's unrelated to the dieting. The fact that your caloric intake is down to barely nothing, or on the flip side of that, barely something in that of weight gain. Trouble sleeping or sleeping too much. Again, that goes back to the sleep conversation we had before. If I'm not checking WebMD at 2:30 in the morning, maybe I have a chance to sleep. So certainly it's something where depression can go hand in hand with this. Loss of energy or increased fatigue. Yeah, there's been some fatigue over here, but I think it's more due to the demyelination and the exacerbation, which more or less, again, you go through a battery, there's going to be a 3 or a 4 for that line item. So there it is. Increase in purposeless physical activity, just sort of extraneous stuff, slowed movements or speech. Like you become almost in the cell of your own brain because you're so paralyzed by just the depression that's around it. And you're just not doing anything about it, and just wallow, just be there. Which I'm using these words for myself because, truth be told, same here, something I've gone through. And feeling worthless or guilty, which I gotta be honest, I felt that too. No matter who's around you, no matter what you do, if you still feel worthless or guilty, it's depression. Or it's at least something that needs to be addressed. If you don't address it, it could just get worse. And in cases of other things like demyelination, multiple sclerosis, etc., it does get worse. See if I can bring Sarah's comment while having this slide up. Oh, good. Sarah says, perhaps you're describing depression mixed with grief, and they are 2 different things. Yeah. Yeah, they are 2 different things. And the thing is, there is a ton of grief, but there's also a bit of depression as well. Whether it's a question of the heredity, or that sort of heredity sort of lines as far as the depression, or the grief of the things that you've gone through, the closing of certain chapters, the grief of realizing what you're trying to work towards, but the work that has to go within. It's definitely there for sure. Alicia asks, what is different, Sarah? So we talk about how do you know that you're depressed. There are many different batteries, different scales, different questions. It's something that your therapist, whether you're using stuff like Talkspace or any other app-based therapy, or the therapist of your choosing by going to like psychologytoday.com and actually seeing a therapist, they'll walk you down that path. There's the PHQ-9 patient health questionnaire. There's a Beck depression inventory. There's the Hamilton rating scale. There's a slew of others. Those are 3 that come to mind. But it's basically the same sort of questionnaire where you're given a statement or a question, and then you're asked a 4-point Likert scale as far as Is it a very common feeling? Is it a very rare feeling? Is it a feeling that you don't have? And you go through that. So you look at the right hand side, it's like feeling guilty all the time, or being restless or agitated that you have to keep moving or doing something, or being disappointed in yourself, or having lost most of your interest in other people or things. Basically tied back to the list I showed. But it's these are the things. These are the things you would be asked about. And I'm going to go back to me for a second because the conversation in here has picked up a bit. I want to address some of it. Hello again. Sue says, I'm glad to listen to this. I'm learning a lot. I thought it was a choice to be depressed or happy for today. I hope it's okay. I'm here anyway. Sue, I'm really glad you're here. And quite frankly, for a lot of the topics we talked about, Sue, I'm really glad you're here, and I'm really glad that you're fighting the same fight that many of us in this room, many of us on this live stream, in this audience, are fighting. Sue, it's definitely a great thing to see you, and it's an honor to have you here. Hump says not only depressed, he's in cultural shock in America. So hole dwelling, in my opinion, option. Avenues of progressive conversation between politics and anti, and then it just ends right there, which I can't get up here. Gilly says, I stuck with John's podcast in my ears. I focus with coffee and I'm writing in my book and working on my program now. Gilly, that's great. That's the greatest thing I could hear all day. Journaling, meditation is basically one of the main hallmarks of what I've been through the last 2 years. And as I'll tell anybody who goes on any sort of dietary program, you could talk about the diet. You could talk about a physical regime, changing your physical activity. But it starts with your mind. It starts with your brain. If your brain is not seeing the need or is not working through the mechanics to get yourself to that place, at some point you're going to get pushed back, whether it's by your own devices or by others. So I'm glad, Gilly, you're doing that. Big time. Alicia says, I wish it was a choice. It's not a choice. Gilly says that at this exact moment. Yep. Sarah says, much longer conversation. The thing is, grief shouldn't be short-circuited or medicated. Depression can be effectively medicated and does not always require long-term prescription. She goes on to say, this is especially true with depression related to post-traumatic stress disorder, PTSD. Yeah, it's these are things we normally don't talk about. It's easy to talk about weight loss. Granted, pen to paper, right? Easy to talk about it, but how many times have we gone down that road just to give it back? Well, many times in my case, 3 times at least. But then also other things like, well, you had a drinking problem. Well, again, that's easy to identify. I have a drinking problem. I can't stop imbibing. I just gravitate to another drink. 1 becomes 2, becomes 4, becomes 8. Same thing with compulsive gambling. That sort of glimmer that's in my eyes, that sort of almost hypnotic stare into the look of a video poker machine or what's going on a poker table or a blackjack table or what have you. Same thing. Easy to identify. Easy to know that there's a problem. You can identify that. When we start talking about situations with grief, with depression, with frantic behavior, it becomes a lot trickier. Now you have to go to the work that your mental health specialist does, the work that basically those questions that were just asked. But moreover, when you're starting to feel things like, I don't know, it's a bit numb, a bit desensitized, a bit muted, well, then it becomes a question, well, it's more than that. It's more than, oh man, I'm going through this again. It's now what exactly is going on with me. And that's not easy to identify. It's not something that we normally talk about. We're going to talk about it here for sure. Let me go back to the deck. So these are some of the ways you would find out that you're depressed outside of the work that you would do with a clinician, work that you would do with your mental health professional. The last piece of this, though, is depression and demyelination. And I apologize for the font size on this. Fact of the matter is there is a number that's out there of over 50%. And I saw something within the last hour that number might be more like 2/3 now. That folks that have MS are at least a half to 2/3 the time fighting some sort of depression. And I would not be surprised by any lack of the imagination that I'm going through the same thing too. We refer to MS being an autoimmune disorder because the immunity that we have is now under siege by one reason or another. And then the thing is, and this is something that I'm honest to God guilty of, is emotional blunting and then also irritability. Not necessarily psychosis, but the depression definitely fits in, especially when I start recalling the feelings I felt in 11 and recalling the feelings I felt in the last 3 weeks, maybe as long as 5. You know, the thing is, when your mood starts going, that's also a telltale sign, especially if you have other symptoms that would stand out. The mechanism between the relationship of depression is not understood. There's a lot of things about MS that's not understood even to this day. Although the field is growing big time. You have consummate MS centers, MS competency centers, areas of research in that of Penn Medicine. Another one I think of is Cleveland Clinic, but also Johns Hopkins University. When I started consulting down in Baltimore, I'd gone to the JHU neurological center, worked with one of their neurologists who put me on a quick dose of Solu-Medrol, and fortunately I didn't have to worry about it again. But I think I was just escaping something else, to be honest. If you think about where the sort of landscape was as far as healthcare is concerned, to say that you have a long-term disorder, a pre-existing condition like MS, it's not the sort of thing you want tied to your name, tied to your medical record. You don't want to see that sort of ICD code or any sort of HCPCS code tied to your medical history. But I think now more than ever, it becomes a catch-22, and I think, and I'm not going to go down that road, but you can understand why it's a little more gentler and freer to go ahead and say I am now than I was 10 years ago. And so much so that I wanted to slip something under the rug and say, oh, it could be something else. Maybe it is Epstein-Barr. Maybe it is a mimic. Who knows? But what I'm going to be told on Thursday is exactly what I'm telling you right now, in the sense that if it's not MS straight on, it is MS-like and enough to just fight this head on. And with the medications that are available, what's not to stop me to do that? There are things that are used for diabetes, like metformin, that are being tied to studies that cause remyelination, not demyelination. This is great news. There needs to be more studies to go on and more research, but if you told me that there are drugs out there, supplements out there, but moreover, a drug like metformin that does wondrous things like that, not sure if I'm dating myself when I say that, but it could be the Lorenzo's oil of our generation, in the sense that if we have a drug that can repair the damage, that can reverse the damage of any demyelinating disorder, any sort of MS, that is humongous to many millions of Americans. Because it's such an individualistic disorder, I suspect that there are some people that have MS who don't even realize they have MS because their symptoms were so minor, so easy, so not life-threatening that they never got formally diagnosed with it. But now is an interesting time here in 2021 in the sense that maybe, just maybe in our lifetime, we will have a cure for MS. We definitely have a lot more drugs that can modify the disease, but not yet a cure for it. One main explanation suggests that depression and memory disturbance correlated to demyelination in the limbic system, which is underlying your central nervous system, is caused by MS. Basically, the rates of depression significantly elevated in patients. The stories foreshadow that depression is a very important clinical harbinger of active demyelination in MS patients. And just explaining this and living all of this makes it evidently clear that is definitely a player here for sure. Some more comments. Sarah says it's always scary and depressing to get a serious diagnosis of anything. Yeah. Yeah, it is. And if I said there wasn't a time yesterday after the MRI and not even getting the results yet where I started crying a little bit, I was. It's depressing, especially when you tie it back to everything I have been working on. But then also the many different things that have changed in this life. It's definitely sad. It's definitely depressing to say the least. But there's a way to put one foot in front of the other, one step at a time, one day at a time. As I posted out on Facebook, that's what I was talking about, was this. Sean says, hey everyone, hey John, hey Sean, how are you? Hope you're doing well. Sarah says that's happening with many things. Medications for epilepsy can be used in very small doses to treat certain types of depression. Yeah. Yeah, I mean, there are a lot of different avenues to go down that we're treating one thing, but are treating a lot of other things. Things that are common. Things that are basically affecting a lot of people. So, yeah. Sarah says stem cell research will impact all of this. Yeah. Oh, yeah. Yeah. You talk about any neurological disorder, whether it is multiple sclerosis, whether it is people who had a stroke, that sort of thing. What you find in stem cell research can change the game for so many people. And so important, why we must remain down that road. Sarah says, tears release stress hormones, not to be stifled. Stoicism is not recommended. Yeah. Stoicism is definitely not recommended. Very well put, Sarah. Sean says, great to see you, John. The epitome of mental strength. Sean, it's great to see you. I've learned a lot of things from you, sir, and it's great to see you this evening as well. I think that was the last slide. Yeah, it is. A bit of a preview of what's coming down the pike here. Episode 2.2 on Thursday. It's going to be more of a clinical talk about depression. The person that I'm scheduled to have on Thursday also knows about my story, so I may be a bit selfish and ask a few questions about what's going on over here too, if you don't mind me in asking. I'm still trying to figure this out. And then next Tuesday, we're going to have another perspective on depression from a clinical sort of perspective. I think the thing is, or clinical sort of avenue, I would say, the sort of thought for Thursday is that I want to know more about the certain kinds of depression that's being seen in the clinician's office. People going for therapy, people that are, whether they are going to therapy of their own volition or they're being told to go to therapy by one reason or another. Not a little bit of a tease for Thursday, but there's a little bit of a tease there. I think there's a lot of circumstance related to what we've gone through in this country, in this world, for humanity in the last year that's causing a lot of this. So it'll be very interesting to see that take, for sure. Billy has a comment. Is there any correlation between people who have lost massive amounts of weight quickly and then developing immune system disorders? Gilly? Yeah, possibly. Possibly. The thing is, if you tie this to me losing the weight the second time back in 2011, I had these events first, and then I started losing the weight. Now, granted, I started going down the road slightly, and then I got hit with it. And then there was the 5 or 6 weeks I was out from work, but I wasn't feeling back to my normal self, for about 3 or 4 months after that first event. So, Gilly, there is probably a lot more research that needs to happen there. There's a lot more things I have to discover, and you better believe me that I'll be talking about that on Thursday with my neurologist, because you can't avoid that conversation. You can't. Someone's lost 278 pounds and then their body's starting to cave in neurologically. Is that a thing? Maybe. It'll be interesting to see what they see at Penn Medicine with respect to that. Sarah says you'd better believe it. Plus, people's issues are harder to hide during this time. Isolation impacts it too. Here's a thought. Right around Christmas, this started happening. New Year's Eve, I went to the ER over at Chester County Hospital. I had a friend come with me, and my friend couldn't come with me into the ER. Actually was escorted out of the building because visitation and access is down to a bare minimum to prevent the spread of something I can't say because I don't want to be demonetized. Wink, wink, nudge, nudge. Most of your public health, private health, your physician offices, your clinics, your doctor's offices are all falling under that same blanket umbrella now, which makes things even tougher. Here's someone dealing with, what the heck am I dealing with? I would love to have someone there to guide me through this. And no, they have to leave. It's not really that great. And then also being in the ER, hearing other people just lament about it, having to say goodbye to their friends or whatever because they're in the ER by themselves. It's something that, if I haven't said it once, I've said it a million times. I have nothing but the utmost praise and thanks for our doctors, our nurses, our medical professionals, because the things that they're going through, whether they're on the front lines in the wards that are tied to this, or dealing with other things, they're working harder than ever in a profession where they work hard to begin with. Every time I talk to a nurse, anytime I talk to a doctor, I thank them. I honest to God thank them. Even those that I was little bit persnickety about one system not talking to the other, I checked myself, I apologize, and I thank them profusely for what they're doing. We need them. We need these people. Without doubt, we need these people. Sarah says you can ask if you can record because you don't have an advocate there to take notes or hear without the emotional upset. That's going to be the strategy for Thursday. I'm going to do something on FaceTime, and I think there'll be a couple people that'll join me for that. Because I certainly am not going to be able to capture everything by myself. Even though I'll ask for the most copious notes one ever can take on this. He is a doctor of neurology. I don't know if he will be able to provide me all that, but I will ask, and I definitely will try to FaceTime and have someone there, at least in the room virtually, taking note of what's going on. And on that, that's it for this episode. And I'm going to say the same thing I tell you at the end of every single episode. I think now more so than ever, in the sense that you have to stay safe, stay sane, stay strong, and stay sober. You're worth it. I'll see you again Thursday night at 6:30 Eastern, 3:30 Pacific, as we continue this conversation about depression. Good night.